This is the Fertility Friday podcast, episode number 45. Welcome to the 45th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. If you've been enjoying the show, I would love it if you would take a moment and leave a review and a rating on iTunes. It helps the show to move up in rankings, and it also helps more people to find the show. And of course, I'd like to say a special thank you to all of the listeners who have left reviews already. I read all of the reviews, and I really appreciate you taking the time to let me know how I'm doing. And if you enjoyed today's episode, please stop by the show notes page and leave a comment. You'll find all the episodes at fertilityfriday.com/podcast. And you can also find me on Facebook at facebook.com/fertilityfridays with an S, and on Twitter at fertilefriday. And as many of you know, I've recently created the Fertility Friday Facebook group. So just go to fertilityfriday.com/community and you'll be redirected to the group. And of course, my plan with the group is to create a safe space for like-minded women where we can learn about the fertility awareness method and support each other. And in today's episode, I'm very excited to welcome my guest, Dr. Fiona McCulloch, to the show. Dr. McCulloch is a naturopathic doctor who has been practicing for 15 years in Toronto, so in Canada. She's the founder and owner of White Lotus Integrative Medicine, a clinic specializing in women's health and fertility. Dr. McCulloch's clinical focus is on fertility, PCOS, autoimmune disease, and thyroid health, and she treats a wide variety of other conditions as well. Dr. Fiona just finished writing her first book on the treatment of polycystic ovarian syndrome called 6 Steps to Reverse Your PCOS. So this book will be available next year. And in today's show, we'll be talking about the connection between autoimmune disease and fertility and some of the ways that these conditions can be treated naturally to improve fertility and help women conceive naturally. So without further ado, welcome to the show, Fiona.
Thank you so much, Lisa. It's an honor to be here today.
Oh, thank you so much. I'm so happy to have you. So although I did give you a bit of an introduction, I'd love for us to talk a little bit about your background and what inspired you to focus on women's health and fertility in your own practice.
Sure. So I've been practicing naturopathic medicine for 15 years now. And when I first started my practice, I actually became very interested in women's health right away. I had some really good success with fertility patients, and so I became very interested in it. And I've also gone through my own hormonal issues because I do have PCOS myself, which was actually undiagnosed for much of my life until I actually became a naturopath myself and realized that having very irregular periods every, 45 to 50 days and cystic acne as an adult wasn't exactly a normal thing. And so just with, trying to fix my own hormonal issues and also with working with my patients, I became very, very interested in this area. And my own mother has a very severe form of rheumatoid arthritis, which started when she was around 30 years old. So many of her joints have been completely damaged by her RA. And so in, trying to help her, I also became very interested in autoimmunity. And so that's how all of this sort of got tied together and where my interest started up in this area.
Okay. And before we delve into autoimmunity, we often talk about what isn't working, of course, when we're talking about fertility and infertility. So maybe we could start by actually talking about what factors are essential in order for conception to occur.
So in general, there's quite a few things that we really need to be present in order to be fertile. So the first thing we often think of is definitely the hormones. So our hormonal balance must be in the right way. So we have to have a good amount and rise of estrogen in the first part of our cycle, and then a rise of progesterone in the second part of our cycle. And we also require a lot of other hormones to regulate the cycle, including androgens like testosterone. And the other hormones, such as the thyroid hormone, are involved in our female cycle and can influence our female cycle. So definitely having those good hormonal fluxes and the responses of the pituitary gland sending signals to the ovary and the feedback mechanisms, those are key and very basic parts of being able to reproduce. Now, when we think about where the hormones are coming from, we start thinking about our ovaries. So the health of our ovary is very important. And the quality of the follicles is very important, because when you think about where does estrogen actually come from, well, it comes from the follicles primarily as they're developing and growing throughout the follicular phase of the cycle. And the progesterone also comes from the corpus luteum, which is what the follicle turns into after the egg has been ovulated. So quality eggs actually produce hormonal regulation, and vice versa as well. The hormones regulate the quality of the eggs as well. And then when it comes to looking at how, what influences our ovary, there's so many things that can be involved. So basically any sort of inflammation can influence our egg quality. High insulin levels can influence our egg quality. And our circulation obviously is very, very important when it comes to the egg quality. So if we're not getting enough blood flow to our ovaries, we're not going to be able to produce healthy follicles that have all the proper types of cells required to be healthy inside of them. So the other things that can influence our fertility, of course, are the hypothalamus, which is part of our brain. And the hypothalamus is particularly good at taking signals from the environment, such as recognizing if there's a situation where we don't have enough food, or there's a lot of stress. If there's a lot of exercise or a lot of psychological stress, that can actually impact our pituitary gland. And that can, decrease our ability to regulate the cycles of fertility and reproduction. In humans, reproduction, it's a huge investment for us, and it's something we don't do very often in our lives. So our brains are programmed to do it at the time that's the best. So if our brains sense that something's not quite right, like if we're in a situation of famine or extreme stress, the brain will actually decrease reproductive capabilities at that time.
I think that's a really interesting and important way to look at it, because obviously reproduction is essential for us to, sustain our our race and everything, our human race, but it's not essential for our bodies. If that's correct. Breathing is essential, and
exactly.
those types of things. But reproduction is actually the thing that gets shut down if our bodies don't feel like it's the appropriate time. So I think it's a really good point.
Mm-hmm.
And so obviously one of the big areas of your work, as you talked about already, and as we're going to talk about today, is the connection between autoimmunity and fertility and fertility. So maybe you could talk a little bit about how autoimmune diseases is actually connected to fertility.
Okay, great. So, yeah, that is such an interesting topic. And once that became more known, I would say that would be within the past 10 years. I became really, really interested in this specifically because I'd been seeing so many patients who had some of these factors with the immune system who were not able to conceive and who were trying all sorts of treatments for hormones or IVF or a variety of different fertility treatments, and they just weren't working for them. So when you think about autoimmunity, there's something to consider. So there's different ways the immune system is involved in reproduction, but when it comes to autoimmunity, what is that? That's basically our immune system attacking our own tissues. So the immune system has produced antibodies against our own cells. That's one sort of immune dysfunction that can relate to our fertility. But in addition to that, we also just have immunological factors. And these are not true autoimmunity, but they have the same outcome and the same results as autoimmunity. So when our immune cells attack our own tissues, what do? They release different chemicals that produce cell damage and cause changes locally, biochemical changes that disrupt our body function. However, there are other situations where our immune system can do the same, although it may not be attacking our own tissues specifically. So I call that immunological infertility. And although they are very similar in their outcome, they may not actually be a true autoimmune disease. So basically, there are different types of conditions where I'll think of the immune system as being involved in fertility. So the one that we think of most often, I would say, is probably recurrent miscarriages. So this would be in cases where there's really no reason for there to be a miscarriage. For example, if a woman is 44 years old and is having recurrent miscarriages, that's not necessarily immunological because that could be an embryo quality issue. But in a younger woman, for example, who's having recurrent miscarriages, maybe 5, 6 miscarriages, even when it comes to 2, I start thinking about it, then, often the immune system is the cause of that. And thyroid is another cause that we should think of too. Another one is implantation failures. So for women who are doing IVF and they're getting, great quality embryos and implanting them and, they're getting chemical pregnancies and these embryos are not taking, we often think of the immune system in those types of cases as well. Other situations I'll think of will be premature ovarian insufficiency. So this is at a younger than average age, having a diminished ovarian reserve. So patients who have that, often there's an immune component if you look deeper. And then patients who have an autoimmune disease, like lupus or Hashimoto's thyroiditis, these patients definitely are going to have immune components playing a role in implantation for them. Some of the other conditions I'll think of will be endometriosis. So endometriosis has definitely has autoimmune aspects to it. The B cells are activated in a way that's very similar to autoimmunity in endometriosis. And there's just a lot of inflammation in endometriosis, localized inflammation. The inflammation can be secreted onto the ovaries and damage the eggs. The inflammation can be secreted as the fertilized egg passes down the tube, damaging the embryo. So that's a really big inflammatory immunological fertility condition. And then the other ones I think of are PCOS and metabolic inflammation. So we don't often think of that as an immune condition, but PCOS actually is an immune condition. And there's a lot of inflammation, chronic inflammation, mostly coming from the fatty tissues, even in lean women. And this actually is very disruptive to the ovary. So basically, when you think of the immune system being overactive or dysregulated, it's basically damaging chemicals, the same ones that we use to kill off viruses and bacteria. And these are called cytokines. These are also damaging to our own cells if they're not calmed down. In between, it's normal to have that if you have an infection, but that should stop at a certain point. But in other conditions, it's like we just have that going on continuously, and that's very disruptive to our bodies.
Okay, so from the description, it sounds like it obviously has a far-reaching impact, and obviously all of the different related conditions that you just mentioned that have an autoimmune component. So to make sure that I'm understanding, it sounds like when you have this autoimmune component going on, or an overreactive immune system, or basically an immune system that isn't functioning properly or optimally, it's actually going after our own cells and just creating this disruptive process that is just affecting the eggs, affecting the ability to implant, just impacting all of these different aspects that are needed in order for conception to occur.
Exactly. Yeah, it's just a very disruptive process. It's something that, we definitely need in our bodies to fight against various invaders, but that particular state of immune function is not really a good state to be in early pregnancy, especially.
Okay, and what are some of the reasons why this happens, and why it's happening in so many women? And of course, there's different immune issues that are happening in men as well, but we're talking primarily about women. But why would you say this is happening so much these days?
Yeah, that's such a good question. We don't fully know, but there's a lot of hypotheses and theories as to why this is happening. So a lot of it can be related to actually our gut and our diet. Um, and our microbiome that's in our intestines. So our microbiome has a very profound effect on our immune system as a whole. And even as infants, as children, we're taking a lot of antibiotics, and we're not really getting that same exposure to the natural environment that we used to, and playing in the dirt and all of these types of things. So we're living in a more sterile environment. We're taking a lot of antibiotics. And we're eating a completely different diet. So a lot of these bacteria, the foods, the beneficial bacteria, the foods they would thrive on, are not really in our diet anymore. And even from the time of childhood. So we're just not developing that really good gut flora. That's a big part of it. Other things that are probably playing a role in this, I am pretty sure, environmental toxins. They're just ubiquitous. They're everywhere in our environment. We're being exposed to them, and they're being stored in our bodies right from childhood. And the immune system is very sensitive to the environment, and that's really what it's made to do. So environmental toxins are known to disrupt our immune systems, and there's just a completely different variety of what we're being exposed to right from the time we're developing. Even as fetuses in our mother's womb, we're just being exposed to completely different environment. So these are definite factors. Some of the other ones can be certain infections can actually trigger immune dysfunction. That's for certain. So chronic viruses of various sorts, they can really influence the way our immune system works and develops. So patients who might have any sort of a chronic viral infection like Lyme disease. Some of the other things are related to our hormones as well. So again, going back to those toxins, like if our hormones are disrupted, our hormones actually influence our immune system. And that's why autoimmune disease is so much more common in women. There seems to be a very strong correlation with hormonal fluctuation and the development of immune changes in our bodies. So I think it's pretty far-reaching, the different reasons that we have these issues with our immune systems. But I suspect that it's a combination of a variety of different things. And the other thing I have to say is as well that most people who have an immune dysfunction, there is a genetic predisposition there. So a lot of times you'll see other members of the family who may have, a thyroid condition or another autoimmune condition. So, there's often a predisposition, and then there's an environmental trigger as well. And when you combine all these things, it creates a perfect storm. And one other thing I wanted to mention is going back again to diet. When we're looking at metabolic inflammation, I mean, just the way that we have so much excess intake of food these days compared to what we would have in our natural environment where there would be a scarcity of food. When our fat cells become more packed with nutrients and with energy, they actually start to leak that energy out, and that creates inflammation in our bodies as well. So part of it is also, what we're eating, and just the standard American diet has a huge role to play with this as well.
Mm-hmm. Well, and so for anyone who's listening, or when you have, say, a new patient, you're doing an intake and you're working with someone who's been struggling with fertility issues, what are the symptoms, or what things trigger you to think about, okay, maybe this is autoimmunity? How might somebody know that this is something they should be looking for?
Typically the patients that I work with have been through a lot already. I very rarely see somebody at the beginning of their journey, but it would not be the first thing that I would think of unless I would see that there was, a true autoimmune disease or a family history of thyroid disease. But if I saw those, even in somebody starting on their journey, I would definitely think about this. If I saw somebody who was overweight or who has PCOS, I would definitely think about that. Or who has painful menstrual periods. Normally, the menstrual cycle really shouldn't be painful. It should be minimally painful with like a small amount of cramping. But if there's pain that requires you to take a painkiller like Advil, and you cannot function without that on the heavy days of your period, that is not normal. So that would make me think that perhaps there's endometriosis. In patients who have been through a lot, and who've been through, years of fertility treatment, which is a lot of the types of patients that I see, I would definitely think of it right away if there had been unexplained infertility. So this patient's been trying for years and nobody's ever been able to tell, what's wrong here, what's going on. Then I would start looking very deeply at the immune system because something hasn't been picked up yet, and there's always a reason. There's never there's no such thing as unexplained infertility. It's just the cause has not been found. And a lot of the time it is an autoimmune condition when the patient hasn't been thoroughly investigated and they just have done, different interventions that have been unsuccessful. Of course, recurrent miscarriages of any sort, I'm going to think about that in a patient who's been trying for a long time. And then premature ovarian insufficiency. So the ovarian reserve is significantly lower than average for the age. Then I'm going to start doing an immune panel for these patients. So I have specific functional immune panels that I'll use to get a really close look at how the immune system is actually functioning and how it's functioning when it's triggered or stimulated by certain immune stimulating agents.
Okay, I actually had a guest on the show who was telling her story, and she was diagnosed with premature ovarian insufficiency at a really young age. I'm trying to remember the age that she said, but she was in her late 20s when she was diagnosed. So maybe for the listeners who aren't sure what that is, could you just, I guess, briefly just explain what it is?
Oh, sure. Okay, so there's two levels of this condition. The first one is called premature ovarian insufficiency, and the second one is called premature ovarian failure. So premature ovarian insufficiency is basically characterized by the number of eggs being significantly less than average for your age. So if you're doing a test like anti-Müllerian hormone, which is one of the blood tests that we use to determine the ovarian reserve, and that is much, much lower than average for your age. And if you want to see the age averages for AMH, you can go onto my website. I have a post. If you just search AMH and age, you'll find those averages. So if you're 29 years old and you have an AMH of that's around the average of somebody who's 40, that would be considered premature ovarian insufficiency. So in patients with this, we'll often see high FSH on cycle day 3. We often will see short cycles, so cycles that are 25 days long, 24 days long, early ovulation. And the reason that happens is that the eggs are not inhibited from ovulating by anti-Müllerian hormones, which is part of what it does. So they just start ovulating early, and you get prematurely developed eggs of lower quality as a result of that. So that's premature ovarian insufficiency. And usually you won't see the FSH much higher than 24, 25 in these patients. When you start seeing the FSH climbing up, up around like 30, 40 or plus, that's starting to be considered into the premature ovarian failure category. This is often thought of as early menopause, and it's much more difficult to treat, much more it's a more serious condition. And that is often, I almost always find it associated with autoimmunity. Actually, in both of them, I almost always do. There's a statistic from a study that showed that basically 50% of patients who have premature ovarian insufficiency have evidence in their blood of autoimmunity. So, and that's only of the tests that we know that we can do currently and that were included in the study. I'm sure if they did functional immunology panels, it might actually even be higher in these patients. So, that's basically what the condition is, and it's definitely one of the more kind of serious conditions that we'll see in infertility, because patients with this are often given the most dire prognosis by the fertility clinics, unfortunately, and it's a really devastating condition emotionally.
Mm-hmm. Well, and when I kind of have, I always have more than one question in mind, but one of the questions I had was, what kind of tests are you able to do in order to identify if there's an autoimmune issue? And, what do you do if your doctor maybe isn't willing to do the test, or maybe not familiar with all of the tests, or maybe doesn't understand why you want all the tests?
Mm-hmm.
And then I guess the other question is kind of related to what we were just talking about with the premature ovarian failure or insufficiency. If a woman is given that type of a diagnosis, how does identifying if there's an autoimmune component help her chances of conceiving?
Okay, so those are great questions. So I'll just list off some of the tests. And I know that this can be challenging because it will depend on the doctor and who you're seeing if they'll agree to do the tests. Many fertility clinics will do these tests for you, actually, especially if you do have recurrent miscarriages. If you have premature ovarian insufficiency, many clinics will do it as well. But but they may not feel that it will be as useful in your case because of egg quality being the primary problem and the fact that they do IVF, which typically is not as successful of a procedure when the egg quality is low. But I can speak to that as well in a second because trying naturally often works best for women who have premature ovarian insufficiency. So just to go through some of the tests, the typical ones that you would see that would be available through standard labs would be the thyroid antibodies. So those would include, and you'd actually just want to do an entire thyroid panel because if the thyroid antibodies are off, you also want to see the function of the thyroid itself. So that would include the antibodies, which are a thyroid peroxidase antibody, which is called TPO, thyroglobulin antibody, which is called TG, anti-TG. And there's another one called thytrophin receptor antibody, which is not commonly ordered, but that can also be ordered. And then TSI, which is one that we find in Graves' disease. So those are the thyroid antibodies. And then you would also want to add TSH, free T3, free T4, and reverse T3. And that would give you a really comprehensive look at your thyroid. Maybe a little difficult to convince many doctors to order that panel, but yeah. But as naturopaths, we can order these tests, so that's where we often fill the gap there, and we're able to do it for people. For some reason, the thyroid in particular seems to be the biggest challenge when speaking with doctors. But you can also try to find a functional medicine doctor locally who will often be quite open to ordering these kinds of tests. And then another one of the most common antibodies is ANA, which is anti-nuclear antibody. That's like a general marker. It's elevated in a variety of autoimmune diseases. It's well known for being elevated in lupus, but it can also be elevated just without any autoimmune disease, but like as a marker, it's associated with fertility concerns. There's also the cardiolipin antibodies, so those are important to run, and the antiphospholipid antibodies. These can be associated with clotting, so those are very important to look at. Then we have the single-stranded and double-stranded DNA antibodies. Those are often associated with lupus. And then another one that I will do a lot because it's a very inexpensive test and it'll give you an idea about metabolic inflammation, which is HSCRP, which is high sensitivity CRP. And that is a test that we look at more in cardiovascular disease. But you'll find a lot of younger women who have immune components to their conditions who don't have any signs of cardiovascular disease will have a high CRP. And it's a very, very cheap test to do, so it's very easy often to ask your doctor to run that one for you. Another one I'll look at is the total immunoglobulins, so IgG, IgE, IgM, and basically an IgA. So if those are high, what it's basically showing you is your immune system is creating a lot of antibodies, and it's very non-specific, but also not a very expensive test, so fairly simple to convince the doctor to order that. And then when it comes to clotting, I'll often order the following. So a factor V Leiden, protein C, protein S, factor 11, prothrombin gene mutation, and MTHFR. So MTHFR, it's more than just clotting. You've probably all heard about this, but it's a very important test for women who have infertility because it's involved in DNA repair. It's involved, so as you can imagine, very much involved in egg quality and egg growth, also involved in embryo growth, but also with clotting. So that's really important as well. So those are the main kind of basic immune tests. And then we also offer the functional immunology tests, which include, for example, natural killer cell activity. So this is different than a natural killer cell count. So the count of natural killer cells is not very relevant at all. And that's what you'll often see if you order a natural killer cell through a conventional lab. But if you go through a specialized functional immunology lab, you can order a natural killer cell activity. So basically, if the natural killer cells are overactive against a specific type of target cell, what happens is that they are actually, what happens with the natural killer cells is they go into the uterus on cycle day 3, and they're altered by our hormones, and they become uterine natural killer cells. And then in the second part of our cycle, they actually help the embryo to implant into the lining. So if the natural killer cells are activated in the peripheral blood, when they start to try to go into the uterus, they're not in the right state to turn into that helpful uterine natural killer cell, and they just don't have the right function. So that's a test that we'll often find high in patients who have autoimmune dysfunction. It just goes to show you how the immune system is a systemic organism that actually plays. It's complicated, and it's directed at a higher level, and it's very reactive to everything in the environment. So we'll often see that high in patients who have true autoimmune disease or infections. So that's one of them. And then the other one that we do a lot is the stimulated cytokine panel, and that'll do your markers of special cytokines that are involved in implantation. So those include Th1, Th2, and Th17. So if you have a high amount of Th1 cytokines, and these are just chemicals basically that can interfere with implantation and disrupt and dysregulate the immune system, because the cytokines are like directors of the immune system. If you have a lot of Th1, it directs the immune system in a certain way, and that particular way is not good for implantation. And then the other one that we don't want to be high is Th17. So Th17 as well is associated with recurrent pregnancy loss. It's also associated with preeclampsia and infertility. And then Th2, that's the one we want to be predominant for early pregnancy. So we look at the balance between the three of those. We look at them at baseline, so just as they are in your system. And then they take special chemicals that trigger the immune cells to be more active. These are things like lipopolysaccharides, so things that our fat cells secrete, or other things that basically different kinds of bacteria or viruses can secrete. Or, for example, if you have an autoimmune process going on, that would also trigger the immune cells. So then they look at what do the cytokines do when you try to stimulate them. And if they go really off in one direction, then we know that's probably part of the problem, if it's particularly Th1 or Th17. So this is a really detailed look at the immune system, and for patients who really have unexplained infertility or recurrent miscarriages, this can be really helpful, because then what we can do is provide treatments that help to regulate those particular pathways of the immune system that are problematic. In Western medicine, what they'll do is provide immune suppressing treatments. When it comes to premature ovarian insufficiency, this is the second part of your question. That's a different situation, because yes, it will help to regulate the immune system. Absolutely. It'll help with the implantation. It'll help with the further protecting the eggs from further damage. But because there's a diminished ovarian reserve, before you do anything for the immune system, you have to work on egg quality first, because it takes a very long time to influence and protect the eggs. So the mitochondrial antioxidants and all of these treatments that we use for egg quality, which is outside of the topic we're on today, but those need to be implemented first, and then we would work on the immune system second.
Okay. Well, I think that a lot of listeners are probably thinking, wow, that's a lot of tests, when you went through the test to get a really thorough understanding of the immune function.
Mm-hmm.
So I just want to go back to that for a minute. So once when you do the thorough blood work and you really get a sense of what's happening, you get all the results back. So could you maybe talk about, I guess, the whole picture? So what it tells you about what the immune system is doing, and what you can do with that information, why it's important to actually know all of that detail about the immune function.
Yeah, so it's basically when it comes to doing, say if you're doing IVF, for example, and you're going to be going through a very, very expensive cycle, and in the past you've done this and it's not worked, and you've had great embryos. Before you do that again, it's important to know if something is off with your immune system, because you can then treat that before you go into the IVF. And some of the treatments that they'll use in Western medicine are actually pretty intense treatments that you wouldn't want to introduce into your body unless, you really needed to do that. So that's why that detailed look is valuable in patients who are going through IVF. When it comes to treating it with natural medicine, the stakes are not as high. We have a lot longer to try. We're working gradually and slowly. We don't necessarily need to go through all of that testing in the same way that a patient would who's doing IVF. But you might want to look at some of the main ones, which would be the thyroid antibodies, anti-nuclear antibodies, CRP, MTHFR. And if you wanted to look at the functional immunology, that would also be helpful. But if we see any kind of sign of it, or, you can also infer that there is an autoimmune condition if you see that this pattern is very clear with, respect to one of the disorders that I mentioned before, can also go ahead and treat it without, worrying too much, because in natural medicine, the treatments are not, they don't have these side effects and they're not harmful to the body per se. So reducing inflammation, reducing these inflammatory pathways isn't really going to be a harmful thing. And especially if a patient has been trying for a while and what they've been doing hasn't been working, sometimes it's worth a shot just trying to treat the patient and doing a more basic immune panel.
I feel like even though it can be overwhelming, the thought of, all the testing, all the different immune components that are, obviously the immune system is very complicated.
Yeah, it is.
Organ of its own. And obviously for the, someone who didn't go to medical school, it can be really intimidating. But I think on the other hand, that I feel like if a woman's going through infertility, she's been struggling for a while, she's had miscarriages or IVF that hasn't been successful, it's like that would be music to your ears, because you're hearing, wow, there could be an explanation for this. You can find out what's happening, and that means that there's something I can actually do about it and actually kind of get to the root cause.
Yes.
So
Yes.
Let's talk a little bit about what we can actually do. What are some of the ways that the immune system can be regulated and some of these immune issues can be solved through naturopathic medicine?
Sure. So when we think of the immune system, and again, like I would just say before we would start on any of this, if there's any egg quality issues, you just start on it right away. And just because egg quality takes a very long time to influence, so I would just do that right off the bat. Then when it comes to the immune system itself, so what we often think of here very first is, and this is the way I approach it, is to look at the hormone balance. So if something is off with the hormones, if there's a thyroid, if there's hypothyroid, for example, if there's high insulin resistance, that needs to be fixed first. And the reason is that it does not matter what else you do. If your hormones are out of balance, that will influence your immune system. If you have high insulin, your immune system will continuously produce inflammatory chemicals. It doesn't matter what else you do. So that needs to be addressed first. So high insulin, low thyroid. If there's anything else that's dysregulating your hormones, so some kind of hypothalamic problem, high cortisol, all of this, address it first. So we would address that as the second step after egg quality. And that's complicated because it depends on each patient and what's going on there. So you don't necessarily need to do a whole bunch of testing. There might have already been testing that's been done in this area, but an experienced fertility practitioner can definitely identify these types of hormonal issues in patients quite easily. And then after that, the next step I would work on would be the gut. And, this is very, very important as a foundation for our immune health. So we would look at, are there any signs of infection in the gut? So any signs of small intestinal bacterial overgrowth? Are there any signs of yeast overgrowth? So these might present as bloating after eating, symptoms that look like IBS, irregular bowel movements, food allergies, food sensitivities. Any of these things, we would need to work on eliminating. So eliminating the foods that you're sensitive to, eliminating any kinds of pathogens with often using a natural antimicrobial, and then following that up with probiotics. And for my immune patients, I tend to use anti-inflammatory probiotic strains. So there's different ones that are particularly anti-inflammatory. So for example, if you think about what a probiotic is, it's actually bacteria. So what can bacteria do to our immune system? Well, they can stimulate it, because it's a bacteria. So our immune system loves to kill bacteria. And that's why so many probiotics are great for being an immune booster. So for patients who have low immune systems, they're getting sick all the time, probiotics have been shown to boost the immune system. So we do want to be careful when selecting probiotics and not just picking any probiotic, because some of them can actually stimulate the immune system even more. So some of the ones that lower the immune system, not necessarily lower, but promote more of a balancing effect and are anti-inflammatory, so they increase the Th2 pathways in our body. Those would include Bifidobacter infantis, Bifidobacter rhamnosus, and Lactobacillus plantarum. So there are different probiotics that we use specifically for patients with autoimmunity, just to avoid adding any more problems to the immune system. So that would be the gut aspect, and that can be fairly involved in itself, especially if somebody has significant gut issues. You might want to spend more time working on that. There's other infections actually associated with Hashimoto's, like Yersinia, Enterocolitica. So there's different organisms that can grow in your intestine that actually can trigger autoimmunity in the body. So that would be my next step, is just working on the gut. And part of that also is improving gut digestive function. So if you're not breaking your foods down properly, you might need some betaine or enzymes. The proper assimilation and digestion of nutrients will create a good gut function as well. So once you've done all of that, which is a good amount of work, but when you think about it, really, like when you're working on the immune system, you're working on your health. A healthy immune system comes from a healthy body. So just like how, fertility depends on that, so does your immune system. And when your immune system thinks that the environment is healthy, there's nothing in your environment that needs to be attacked, then it's going to function more normally. And that's going to be a good state for you to reproduce. So the barrier of the gut is very important as well. So if there's any kind of leaky gut where there's nutrients passing through, or larger food particles passing through, that's also going to trigger immune responses. So healing leaky gut, that can involve using nutrients like L-glutamine and acetylglucosamine. So there's different supplements that we would use, and it all depends on how the patient's presenting with their gut as well. Okay. So after you do that, then you can actually start working on regulating the immune system itself. So there are nutrients that we can use that will actually stop or balance overactive immune responses. Now, if you can imagine, simply using these nutrients, if you have not gotten at the underlying cause, is not going to do any good, because you're just going to be suppressing it, but the triggers are still there. So if you've got, some sort of really terrible hormonal imbalance, it doesn't matter if you suppress the immune system a little bit with some of these nutrients, because they're gentle. You really need to fix those underlying issues. Or if you've got some kind of gut problem where you've got an infection, it's just continuously going to trigger your immune system. So first we fix those, and then we can look at adding additional balancing. So some of the treatments that we look at are, for example, vitamin D. Lots of evidence to show that vitamin D is immune regulating. It increases Th2, which is the state that we really want in pregnancy, and increases our regulatory cells of our immune system. And the regulatory cells are like the little police. They go around and they gobble up all the nutrients in the areas where there's too much immune activation. So we want lots of those guys, and vitamin D helps us to produce those. And vitamin D deficiency is associated with a lot of autoimmune diseases like multiple sclerosis. So that's a very important thing to use, and to make sure your levels are good. Omega-3 fatty acids are another great nutrient that can improve our immune function. So those can also increase our regulatory cells. They can calm down overactive natural killer cells and reduce the Th17 cells. So those are really helpful. We tend to use higher doses of EPA for patients who have autoimmunity. And then another thing I just wanted to mention is the folates. So folates are really important. And so for patients who have the MTHFR mutation, The regulatory cells of our immune system actually need a lot of folates to survive. And if we are not providing them with the folate that they need, they will actually start dying, and there'll be a lot more inflammation in the body. And that's why a lot of patients with MTHFR have autoimmune and immune dysregulation of various types. Yeah. So those are just a few. There's just so many. I couldn't even go into them all.
Well, I'm glad you mentioned MTHFR because I've gotten a number of questions about MTHFR. Obviously, we could do an entire podcast on that topic because it's a very big topic. But maybe you could just briefly give kind of the elevator version of what it is and why it is important, especially if women are why it's important for all of us to know about, and also particularly in women who are having fertility challenges.
Oh, sure. So MTHFR, it's an enzyme, and it helps convert folic acid into something called methylfolate. So this is a very, very important enzyme in the body. Methylfolate is used for so many things. So it's used for DNA repair. It's used in the production of DNA. So as you can imagine, it's foundational with respect to the way our body functions. So cell repair, it's all dependent on MTHFR. And as you can see from my example on the regulatory cells, the cells need a lot of folate to reproduce and grow. And so our cells simply will have trouble in this function if you have MTHFR. And it also, as a result of that, can affect our risks for cardiovascular disease and clotting, because a lot of these regulator cells that help to prevent these issues are impacted by not having enough of the folate. So you can have a mutation in this gene for the enzyme. So there's different types of mutations that you can have, and there's 2 different MTHFR enzymes that are important. The big one is the C677 enzyme, and that's the one that's associated with the most issues with respect to clotting, with respect to cardiovascular disease, even cancer, and immune dysfunction as well. So if a patient was to have 2 mutations in that gene, they would have a very severely impacted ability to use folic acid. In those patients, there would be a much increased risk of miscarriages, but also birth defects. So spina bifida and these types of disorders would be more predominant because there just wouldn't be the ability to use the folic acid that they've been taking. So the other one is the 1298, and that one is not as severe of a mutation. However, if you were to have 1 copy of the 1298 and 1 copy of the C677, that would put you into a more, that would be significant. Not as significant as having 2 copies of the C677. So when you get the test, you do want to get both mutations checked, and then it would be good to go to somebody who really knows methylation. That's what the science of treating methylation problems is. Generally, we recommend that patients who have MTHFR do not use folic acid and use methylfolate. Their body cannot use folic acid at all, and it will just float around unmetabolized in the bloodstream. So that can actually downregulate the receptors on our cells to folate because the body thinks there's too much floating around, but it's not getting into the cells. So generally, methylfolate is the preferred nutrient. And most patients who have MTHFR also have additional needs for methylcobalamin, which is B12, and can also have increased needs for vitamin B6, P5P. So depending on what your overall picture is and what your MTHFR results look like, there's going to be increased needs for those nutrients in the body. And there's another compound called homocysteine that can accumulate in the blood of people who have MTHFR, and that's also associated with inflammation and cardiovascular disease.
So in women that have the MTHFR gene mutation, one type or another, or to some degree, they take their garden variety prenatal from the store that's full of folic acid, and it's really not doing a whole lot for them. It potentially even making things worse is what I'm hearing.
Yeah, potentially it could be. Yeah. It's definitely not optimal, that's for sure. So, and there's a lot of people out there like Ben Lynch, who is the pioneers of MTHFR research, and he really is against using folic acid in patients who have MTHFR because he's done a lot of research showing that it just accumulates in unmetabolized folate in the blood, and that causes the cells to not, take in the other folate. And then the folic acid in the food, processed food, is another issue which he speaks out quite a bit against, and I tend to agree that this there's a lot of the population who have this mutation. It's fairly common. So I think the stats range from 20 to 40% of people. So depending on the type of mutation. So there's a lot of people out there who can't use that folic acid that's in the food supply.
Mm-hmm. But you can obviously address to some extent the folic acid issue by supplementing with prenatal vitamins, or particularly a supplement that instead of folic acid has the methylated version of folate.
Yep, absolutely. Most of the quality supplement lines now do have methylfolate, and you'll see it labeled as L5-MTHF or methylfolate. So yeah, just look on the label and just make sure it does not say folic acid and that it says methylfolate or another version 5 MTHF.
Yeah, I think that's really important, just that, because I think you want the best quality supplements, and if you don't know if you have that gene mutation, and you're struggling, you might want to consider making sure that you're actually getting that folate absorbed and where it should be.
I know. It's so true. Like, that's what I always tell people. We don't, if you don't know if you have the mutation, just take the methylfolate because you can't go wrong with that. We can all use methylfolate. It goes directly into the pathway. And the other thing is you can eat leafy greens raw. So spring greens, romaine lettuce, any kind of leafy green is going to have a lot of natural folate, and that can be used by your body even if you have MTHFR. So try to eat that. Eat a big bowl twice a day.
Mm-hmm. Well, and as we kind of get towards the end of our time together today, I wanted to ask you a little bit about, I guess, the importance of diet in general, the importance of food. And also I know we don't have time to go into it thoroughly. You had mentioned egg quality and how it takes a bit of time to ensure that. So for someone who's listening, I guess, what are some things that we can all do in terms of our own diet and in terms of just, I guess, general advice for women who are trying to conceive and wanting to know, like, what are some of the things I should just be doing in general?
Okay, so I love that you asked this question because I want to address it in two different ways. I find a lot of fertility patients are, obviously this is an extremely stressful thing to be going through. Like, it's one of the most stressful things disease-wise that any patient can go through, and it's been rated as equivalent to cancer and heart disease, stress-wise for patients. So what I want to say first of all is when you're looking at your diet, don't be too stressed about it. So do your best with what you can. But I can tell you, I have a lot of patients coming in to see me whose diets are what I would consider perfect and who are, feeling very overwhelmed by the stress of trying to achieve that. Now, there are some patients who cannot eat certain foods because it makes them sick, and so I'm not including those patients. I'm just including, your typical patient who's got, who's trying to conceive. This process can go on for some time, so you don't want to be, can't eat this, can't eat that ever, and not able to socialize with your friends, not able to enjoy your life, and feeling like you're trapped in this bubble of infertility. So I always tell people, unless the food makes you sick, then it's 90% you have to try to eat well. And so that's the first thing. And I think that takes a lot of the pressure off because I just haven't seen that matters very much, being absolutely perfect, as opposed to being 90%. Eating properly and healthfully. Now, in patients who have food reactions, food sensitivities, autoimmune triggers, that's different. And there are certain patients who should never eat certain foods. So I definitely want to differentiate those two things. So that being said, when we get back to our 90%, what we really want to think about eating is, first of all, getting rid of anything with chemicals, toxins, pesticides. So processed food definitely falls into that category. anything most things that are in a box are probably not a good idea to be eating. And shopping around the perimeter of the grocery store, so all the fresh fruits and vegetables, and if you're eating animal products, trying to get the best quality that you can possibly afford, that would be a great way to spend money is on quality meats. So organic, grass-fed beef or pastured pork or organic chicken would be the best, and wild fish. So these are they can be a little bit expensive. If you can't afford that, then definitely try your best to get the lowest contamination species of fish, which you can get from the list from the EDF.org. They do have the seafood selector on there that'll show you which fish are the least contaminated, and wild caught fish are generally very safe. So that would be ideal. And then carbohydrate, typically we look at trying to minimize or eliminate gluten in that it does disrupt the tight junctions of the gut for everyone, regardless of whether you react or not. So the repeated ingestion of it may be inflammatory for most people. And dairy as well, for most people, difficult to digest, but also contains hormones that that are there actually to promote the growth of baby animals. Not necessarily helpful for humans, especially if you have a metabolic disease. You're ingesting IGF-1 and insulin when you're drinking milk, and that's great when you're trying to grow a baby animal, but not really good for adults. So that should not be, generally we advise against eating a lot of dairy. Now, some people can tolerate, organic, high-quality fermented dairy in small amounts, and that's a completely different situation. So it's always individual, but the basics are lots of vegetables, small amounts of healthy fruits like berries, green apples, bananas that are not very ripe because those have good amounts of resistant starch that are good for our gut, and then healthy fats. So you want to have some good healthy fats with every meal. That can include avocado, it can include coconut oil, nuts or seeds, or olive oil if you put it on a salad for cold use. So those healthy fats should be in every meal, and having enough healthy fats in our diet will signal to our brain that there's enough food and that there's quality food, and it will help to promote good communication between the brain and the ovary. So those are, and then lots of water, of course, and avoiding smoking, of course. That's a big one. It's very, very toxic. Obviously, we all know that, but still, there's a lot of people out there who still smoke. And when it comes to caffeine, I'm usually I usually will say that 1 coffee per day is probably fine for most people, unless you have an adrenal problem. Green tea is great, and most herbal teas are fine unless you're taking excessive amounts of them. So those are the basic diet recommendations.
Okay. So a few final questions just to wrap up the interview. What would you say is the biggest myth about fertility in general that you'd like to see corrected?
Oh, that's a really good question. The biggest myth, I would say, is probably that, this is what I think is one of the biggest problems, is that if it takes a woman a little bit of time to conceive, that she must go through, a fertility clinic and medicated cycles and IVF. I think that there are instances where that is necessary, but I think that there's a lot of times when we almost feel that that's our only chance to get pregnant is to go there to the fertility clinic, and sometimes that can put a lot more stress on us in every way. So the whole process is stressful. In many patients, it's not really the only answer, and I can say I've seen just hundreds of patients who've done these types of medicated cycles, and they haven't worked, and then they've tried naturally and they've been able to conceive. So I think that it's always good to remain open and do an investigation before going to that level. Although I refer my patients there, absolutely, there are many patients who need those treatments, but I wish almost that we could do integrative fertility first before patients would go through the more intense cycles. But, again, I work with a lot of fertility doctors, and they do work miracles in many cases. So it's something that I think it's an amazing thing we have access to these days. But at the same time, when we can work on these underlying issues from an integrative approach, even if a patient does need to go that route, it will work. It'll have a much better outcome because we'll have improved egg quality and overall health as well.
Mm-hmm. Um, yeah, that's great. I love what you said about integrating the two and really working as a team, right? I think that that's ideal.
Absolutely.
What advice, if any, would you give to a woman who is struggling with fertility challenges or has been told by her physician that she can't conceive naturally?
Um, I would say that the very first thing to do would be to have a really good investigation done and have a closer look at everything because a lot of the time, um, things aren't really, there's just not enough time. I mean, sometimes when you go to the doctor, the amount of time that you have is not very long, and maybe they don't have enough time to look thoroughly through your case. So if you do go to a naturopath who specializes in fertility, you'll get a much more detailed look just simply because there's a lot more time. You're having a person who's specializing in this area really like, picking through every detail of your case. And often you can find a lot of things that have been missed before. So I would do that first. And then the next thing I would say is don't give up hope because I've seen so many patients who've been told that they can't conceive. And I would say the vast majority will conceive if they get on the right treatment. I would say almost everybody after some time will conceive these days. We're very fortunate. We have a lot of tools and a lot of understanding of the female reproductive system that we didn't have even 10 years ago. So there's a lot of hope out there. It's a frustrating and it's a stressful and it's a sad journey, and it's hard to go through, but just hang on and don't give up hope.
Okay, and last question of the day. For a woman who is on some sort of hormonal contraceptive, she doesn't want to get pregnant today, but she's thinking about trying for a baby in the next couple of years. What advice, if any, would you give to her?
Um, so yeah, I mean, I would think like first of all, if a patient's been on a hormonal contraceptive, was there a reason for that? Like medically, like so did they have problems with their periods? If they did, then I would suggest to come off the pill well in advance of the time that you'd like to try to conceive because you may have a lot of things that you need to work on at that time. So that's key because a lot of women go on the pill because they have painful periods or their periods are very irregular. They may have PCOS or they may have endometriosis that's being masked by the pill. So this would take some time to work on, and also to have a full assessment done 3 months after the pill you've stopped the pill, just to be able to identify what's going on in your case. And in patients who just are using the pill for birth control, I would definitely make sure you're on a good prenatal with methylated folates and methylated B12, so methylcobalamin. And, then when you're ready to come off the pill, you could also do an assessment at about 6 months afterward and just make sure that everything's going well. You might also want to consult with a naturopath as after you come off the pill, just to help with the reestablishment of the menstrual cycles after birth control, because sometimes that can take a little while. So if you want to start trying a little bit more quickly, you can get a little help along the way.
Okay. Well, thank you so much for being here today, Fiona. I really enjoyed our time together, and I really appreciate you taking the time to share your knowledge and experience with the audience today. As the listeners and myself can attest, you are an absolute wealth of knowledge, and your clients are just so blessed to have you specializing in this specific area and working so hard to help women reestablish their fertility. So how can our listeners find out more about your book, if they'd like to work with you, if they happen to live in the Toronto area, or find you online? Because I know you have a strong online presence as well.
Thanks, Lisa. So if you'd like to get some more information about my book, if you go to my website, drfionand.com, you can sign up. I have a free ebook on the top hormonal lab tests for women. that you can download there, and you'll get signed up to my list, and you'll get information on my book and its release. And please feel free to read my blog there as well. I have tons of articles. Some of them are practitioner level, and some of them are just general reading information. So I hope you'll enjoy those. And my clinic is whitelotusclinic.ca. If you'd like to see me, please send a contact form through, and we'll be happy to see you as a patient there as well. So yeah, so that's basically it. And if you enjoyed this podcast, I have some other podcasts on there too that you can have a listen to as well. And I just want to thank you, Lisa, for having me on your show, because you've had so many great guests, and I'm really honored to be included.
Oh, thank you so much. That's so nice of you to say. I'm the one that feels honored today because I learned a lot from you, even just in our short time together. And I'm just really happy that we were able to meet.
Yeah, well, thank you so much. It's been a wonderful experience.
Thank you for listening. If you enjoyed today's show, please share it with a friend. I'd love to hear your thoughts on today's episode, so head over to the show notes page for today's episode and let me know what you found most helpful from today's show. So you'll find the show notes page at fertilityfriday.com/45. You can find me on Facebook at facebook.com/fertilityfridays with an S, on Twitter at Fertile Friday, and if you're inspired to learn more about the fertility awareness method, you can always join the Fertility Friday community on Facebook. So just head over to fertilityfriday.com/community and you'll be redirected to the Fertility Friday Fertility Awareness Facebook group. And if you've been enjoying the podcast, please look for it on iTunes and leave a 5-star review so more people can find it. Of course, leave an honest review. Let me know how I'm doing. I appreciate all of you for taking the time to tune in to the podcast, whether you're on the go, whether you're commuting to work, whatever you're doing, whether you're doing laundry. So thanks again. And as always, until next time, be well and happy charting.